my name is Kelly Kavanaugh-Salmond, and I'm going to start this presentation off for us. So just to give you a quick kind of overview of where we're going, I'm going to introduce you because we have varying understanding of the Mental Health Promotion Innovation Fund, which we lovingly refer to as the MHP-IF because we are government and we love acronyms. So you'll hear that acronym as we go through, but otherwise I will try to keep the acronyms to a minimum. And then the second part of this presentation is going to be about where we are now and how far we've advanced. And my colleague Leslie is going to take us through that. And then depending on time, the third piece, we're going to be tying back to, serendipitously, tying back to what Mark had said around some of the learnings that we had from our previous iteration as the innovation strategy and how we're reframing success based on those in the MHP-IF. So for now, we're going to focus on the Mental Health Promotion Innovation Fund, MHP-IF. As I mentioned before, we are in our second round of funding. So formerly, this model was known as the innovation strategy. And if you take me to the next slide, I will walk you through. Excellent. So the MHP-IF is a long-standing, trusted, and impactful national funding program that supports innovative, community-based mental health promotion at the individual, family, and community levels. These projects are grounded in proven principles of mental health promotion. Importantly, equity is a cornerstone of this program, and it ensures that the funded projects support the needs of diverse communities, including those experiencing those intersecting health and social inequities. So through its internationally recognized phased funding model, the MHP-IF has demonstrated the power of innovation and dedication in improving youth mental health. So as you can see on the side of this slide, each phase has a specific purpose and time commitment, and we'll walk you through where we are in that shortly. So this funding model encourages multi-sectoral partnership. It integrates equity into the process, and it emphasizes rigorous evaluation and knowledge exchange based on those learnings, as well as the learnings along the process as we move to get to the evaluation outcomes. This is ensuring scalability and sustainability among all of the funded projects. So for over 15 years, when you include the innovation strategy, we did have a stream on mental health promotion. The MHP-IF has been a pillar in building the field of mental health promotion across Canada. So if we move to the next slide, you will see. So currently, the program invests $4.9 million a year into the mental health promotion projects. So that seems like a big number, but when you cut it across so many projects and intervention sites, it's really astounding what we've been able to do with that amount of money. And the MHP-IF was launched in 2019 with its trademark phased approach that we just went over, designed to support community-based mental health promotion initiatives across Canada. So it started with phase 1, and there were 20 funded community projects and 1 hub, as you are all familiar with here today. The funded projects focused on, in phase 1, project design, pilot testing over 18 months. And in this particular iteration, we did have an additional year of what we called pivot funding to support the adaptations amid the COVID-19 pandemic and response. Early projects explored diverse ways to promote mental health equity. So in 2021, 15 projects then advanced into phase 2 and are working with and across diverse communities across Canada. These projects are spread across multiple sectors, from health and education to community services, each addressing mental health promotion through innovative interventions. And in phase 2, the KDE Hub remains central to fostering these learnings and sharing between projects and enabling this broader systems change. So now we have the 15 MHP-IF funded projects supported by the KDE Hub, which are focused on completing phase 2. And we're looking towards phase 3. So if you recall the last slide, we're moving into phase 3. We're right at the end of our phase 2. And this is where successful pilots will begin to be scaled across settings for larger impact. The goal is to move into phase 3, expanding proven interventions nationwide for lasting sustainable change. And so from here, I'm going to pass it over to my colleague, Leslie, to share with us a little bit about what we're learning so far in this iteration.
Great, thanks. If we move to the next slide. Great. So I just want to start by situating the MHP-IF within that kind of broader positive mental health framework. So many of you may be familiar with this diagram, but for those of you who aren't, it's kind of a conceptual framework for the surveillance of positive mental health and its determinants in Canada. So this framework really highlights 4 elements: the individual, family, community, and society, with each element or layer considered as an entryway for interventions that promote mental health. And the MHP-IF model really tries to encourage using multiple entry points to have the greatest impact that lasts. As Mark said, we're really trying to play that long game or continuous game. All of the projects funded through the MHP-IF are actually addressing protective factors and underlying determinants of health across more than one of these areas. And I really wanted to take this opportunity to highlight a few of the really impressive results to date that have been achieved by MHP-IF projects. First, projects have reached over 300,000 people, have reported improvements across a range of protective factors, such as coping skills, resiliency, social connections. Most of these projects are not only working with children and youth, which is really that focus group for the MHP-IF, but also the family that's surrounding these children. So they've reached more than 18,000 parents or caregivers through family supports and parenting programs. These projects have been delivered across more than 800 communities and are working to increase connection, where they're working by creating a welcoming and safe space for community to come together. In addition, and perhaps one of the biggest benefits of having a long-term funding program is projects are working at that society or structural level to really try to address health equity and impact that broader system in which they're working. And I'll talk to some of these changes that we're seeing in the later slides. So one of the things to note is, while we've kind of got these 4 elements separated out in this diagram, they're very much intertwined. And looking across funded projects, we've been able to see that some of the greatest impacts in terms of population health are really from the interventions that are addressing not only that individual, but the family, the community, and the environment, and are really working to support the decision-making for a healthy public policy as well. So from a funder's perspective, we're really looking to explore new ways of trying to really capture some of that complexity. I've been an evaluator with the government for quite a while, and while we love the numbers that we've presented on these slides, we've really seen the impact of trying to describe some of that complexity from our projects over that long term, and are working to really try to move from simply measuring that individual change to some of those broader changes at the family, community, society level, and the complexities and context these all entail. So the last thing I really wanted to highlight on this slide is the importance of partnerships and relationships when working to promote positive mental health. So yesterday we heard quite a few examples of approaches to build partnerships across sectors and different levels. And this is a key requirement for the MHP-IF program. It's really necessary to support each layer of the positive mental health framework. These partnerships take time, they take resources, and that quality of partnerships is really key to creating that lasting change. In addition to creating change, the MHP-IF program is designed to really capture how that change occurs in order to learn and share that knowledge with others. That kind of brings us to the next slide. So the MHP-IF program is designed to support projects to tell their story around what works, for whom, and why. So projects have developed strategies to share evidence-based knowledge products, activities, lessons learned. They really impact future health practices, programs, and policy development. Already, projects have produced over 500 knowledge products that have reached over 280,000 people. Big numbers, but we all know that just because you share a paper or deliver a presentation doesn't mean that this information is going to be taken up. As an evaluator, I think there's always a space for quality evaluation or more evidence. However, within our kind of respective areas of work, I'm sure we can all um, think of things or aware of things that we know that work, that we can back up with evidence that are just really not getting put into practice. In fact, yesterday, I think in one of the breakout rooms, there was a really great discussion that highlighted how a key barrier to creating change was really just getting the information to those who need it. So, as we move to the later phases of the MHP-IF program, we're increasingly asking how the information is that's being generated through this great work at the community level is being used. And once we change the way that we ask questions from our traditional kind of government number crunching to really capture those real world stories and tangible examples, the information and the depth of change that was occurring at these community-based projects was quite impressive to read. Already projects have reported by kind of halfway through phase two, 87 really tangible examples of how that knowledge that's being generated through their work is being used to influence different policies, programming, and practices. And if we go to the next slide, um, projects have not only relayed these stories of impact, but have also really put forward new ways of working to create change at a systems level. So projects have demonstrated empowerment of individuals and groups. For example, we have one project working with the education sector that's worked to really shift power dynamics. So instead of school districts creating programs for Indigenous youth, youth are creating programs with the support and trust of the education system rather than direction. Numerous projects are uniting communities across sectors through partnerships between communities, service providers, researchers, as well as government to really better meet the needs of community. And this has been facilitated by providing a safe space for these partners to learn and work and really to partner together. Finally, several projects have noted that due to their work, they've really seen a shift in how provincial governments or local governments are viewing mental health promotion, with an increase in willingness to consider more upstream community-based interventions. Projects are consistently providing examples on how they've been invited to present their findings and describe their work to different government committees or decision makers across various different sectors, which really leads us to the next slide. So where are we going next as a funding program, and how can we support the systems change that we're seeing on the ground? How can we kind of collectively work to create that change? For the MHP-IF, we're moving into the third phase of funding, as Kelly's already mentioned. So projects are really moving from that focus on evaluating whether an intervention works to that focus on scaling the intervention. In some cases, maybe reaching more people. In other cases, maybe working to scale up through the system. As Mark kind of noted, there are various different kinds of scaling that's occurring, and it really depends on the context in which that organization or project is working. Most often, it can be a combination of these different types of scaling. So for phase three, we're really shifting our thinking as a funding program in several ways. First is really to provide strategic resources to support that scaling. So this may be in terms of financial resources, tools, various different ways. In addition to this, it's important to really ensure that there's a space to deepen the relationships with partners. So we know that takes time, it takes resources to really foster the relationships, especially in sectors where resources are already stretched quite thin. You've seen some of the early results from the MHP-IF projects on knowledge being generated and how that's influenced systems change. So in phase three, it's anticipated that this is really going to continue, and we'll see a greater number and depth of those changes. And then lastly, in phase three, we're really aiming to support projects to better understand the cost to deliver and scale the intervention, whether it's through social return on investment, cost benefit, or other novel approaches. I think we heard yesterday, Dr. Mulligan shared with us a figure on social prescribing that estimated that for every dollar invested, we gain $4.43 in improved well-being and reduced cost of the healthcare system. And I imagine that the work being done by a lot of our community level projects within the MHP-IF would have similar returns on investment, and will help to try to build that case for future investment in mental health promotion. With that, I'll pass it back to Kelly, and she'll speak to how we've kind of shifted our thinking and learned from our programming from the past 10, 15 years working with these programs.
Thank you, Leslie. So as mentioned, about 10 years ago, we were at this exact spot in the innovation strategy, and we were thinking through this idea of scaling. And back then, we were thinking of scaling up. And going back to Mark's comment around what comes first, the framing or the outcomes, and the way that we see it is that recognizing that social innovation and adaptive cycles are necessary for effective scaling, we were then able to develop and apply some of our scale up thinking into that iteration. So if we go to the next slide, I'll just walk you through some of those levels of scaling readiness. And this was for us really a foundational starting point for reframing what this looks like moving into the Mental Health Promotion Innovation Fund. Of course, as Leslie mentioned, we've really expanded our thinking from scale up to include scale out, scale deep, and of course, scale up. And one of the things that we've learned from the funded projects is that often these all happen in tandem in different ways for different projects with different meaning making between each of the three domain kind of areas of scaling. So about 10 years ago, these were our starting points for the domains to assess readiness for scale up. The first was intervention readiness and evaluation. Second, organizational capacity. Third, system readiness. Fourth, partnership development. Fifth, community engagement and context, emphasis on context. Six, cost effectiveness. And seven, knowledge development and exchange, which is really a key theme in the work that we do. So as mentioned, this is part of our cyclical thinking, and we wanted to share this with you today just to give you an idea of where we're hoping to go and where we are in our process of learning as well. So if we go to the next slide, I'll walk you through some of the achievements and learnings from the innovation strategy. So this would have been going into phase 3 about 10 years ago at different levels because we had different streams. But at the end of the innovation strategy, individuals were reached in over 800 sites across all provinces and territories. Interventions reached over 1.71 million people. Over 1,400 partnerships were established by the community-led organizations. These were across multiple sectors, and projects were able to leverage over 30 million in supplementary funds. By phase 3, 90% of the projects and partnerships had sustained impact on policy or public health practice, which is no small feat because, as Mark mentioned, sometimes those windows open and they close quite quickly, and you can't really plan for that as you go through. 82% of the projects were able to continue their intervention through funding from other sources or by integrating into the existing systems through scaling. And then finally, for every dollar invested by the agency, projects were able to leverage 45 cents in additional resources. So as you can see by some of these numbers, and then thinking back to some of the numbers that Leslie shared, the MHP-IF is already surpassing a lot of these numbers by the end of phase 2. And we're really excited to see where that goes as we learn alongside the funded projects this cohort. And if you take me to the next slide, we did publish some of these learnings so that folks are interested in kind of where we are and some of those starting points for us in terms of those cyclical learnings of reframing success for the MHP-IF. There is a special issue from the Canadian Journal for Public Health that you can access that talks about the innovation strategy in a retrospective, and we're happy to share that link here with you. And finally, if I take you to the next slide, we have some snapshots here that exemplify how the MHP-IF is making a difference in mental health promotion, focusing on priority populations and supporting community-driven efforts to identify and address root causes of mental health inequities. You can find some of these excellent infographics, which I still use almost weekly in my work, on the KDE Hub website, kdehub.ca, if you're not familiar yet. And I I invite everybody to take a look through. Of course, you're learning and hearing from projects that are funded through us throughout the course of the last 2 days, but there really are some spectacular learnings and a diversity of projects that are being funded by this cohort. And so finally, as I take you to the last slide, I'm just going to thank you very much for your time. You're welcome to reach out to us. This is our general inbox if you have any questions. And from there, we can keep the conversation going. Thank you so much for your time, and I'll turn it back over.